Hello, I'm urologist Omar Erdamakaya. Today I am going to give you a short video presentation on how and why masturbation causes erectile dysfunction and other sexual problems. What is masturbation? Masturbation is a person satisfying himself under his control. According to surveys, all men of all ages masturbate frequently. So how does masturbation cause erectile dysfunction? Masturbation can cause erectile dysfunction or sexual dysfunction if it is done with a score or orgasm focus, if it is traumatic, if it is done in marriage, and if it is done with pornography. Let's explain all of this. Score-oriented masturbation is performed to say, I did it 5 times today, I did it twice in 1 hour. It is a masturbation that focuses only on orgasm and ejaculation, and person enjoys the numbers of orgasms he has, without focusing on pleasure and enjoying the moment. Traumatic masturbation is also overly squeezed, compulsive, dry, or high-pressure masturbation. If the sufferer gets used to masturbation in this way, he may experience problems with sexual function, such as erectile dysfunction, premature ejaculation, delayed ejaculation, because he does not get the same sensation, pressure, and pleasure from the vagina when he has an active sexual life. He might even think that his partner's vagina is wide. There are women who have undergone vaginal surgery because of this. Apart from this, there is also the case of masturbation in marriage. In marriage, of course, there can be many factors that cause a man to masturbate. There can be problems in the couple's relationship, there can be feelings of hatred, anger, hostility. However, if these reasons are not present and the man turns to masturbation, there may be a loss of sex drive towards his wife and erectile dysfunction. This is because masturbation is a much easier, less energy-consuming, effortless endeavor than sexual intercourse. But in sexual intercourse he must win the heart of his wife, he must buy gifts, he must show a smiling face, say nice words to her. And the orgasm he gets in return for this effort and the orgasm he gets in masturbation are the same. In effect, the brain is saying, do not overwhelm me. Do not make it hard for me, just do it in simple way. Such a conditioned reflex develops in the brain. Apart from that, there is also masturbation with pornography. 25 years ago it was hard to find pornographic material, there were only videotapes. Or they could only be found in magazines, and those magazines were sold illegally. Or there were cinemas where people masturbated. Hundreds of people masturbated at the same time in the cinema. There was no other way to find material. For young people today, access to porn is so easy, they just have a phone at hand and all they need to do is some clicks. If you Google porn, you can see all kinds of porn movies. What kind of problems do porn movies cause? When you masturbate with pornography, the sexual stimulation from pornography is many times higher than the sexual stimulation you can get from outside. This can cause you to become blind to external sexual stimulation. Or it can desensitize you. Because no woman has a chance to compete with the women in pornography. The sexual stimulation you get in pornography is very different from the sexual stimulation you get from the outside. And when you combine that with masturbation, again, a reflex can be created in the brain. I will tell a little anecdote. I had a patient who had no sexual problems. His wife went somewhere for a month. And after his wife left the house, the patient masturbated twice a day for a month. And a month later, when his wife came home, he could not get an erection for her and began to suffer from erectile dysfunction. This was because the patient corrupted the factory settings. He was constantly masturbating and watching porn when his wife was not home. But by the time his wife came home, he was already desensitized to the sexual stimuli he received from his wife. After a while, they get better on their own after he stopped masturbation and porn and seek medical treatment. So masturbation is problematic in 4 ways. First, focusing on the score. Second, traumatic masturbation. Third, masturbation while married. Fourth, porn masturbation. So what is the right way to masturbate? There is not exactly a consensus on this question. But as a rule, it does not hurt young people to do it 2 to 3 times a week. Thank you for listening, and best regards.